Ladies and gentlemen, welcome to today's web seminar. I'm your moderator, Mike Perkowski with TechTarget. We're glad you could join us for the third in a series of 3 webinars on cloud-based application platforms. This program is sponsored by Progress Software. We want to thank them for their support. Today's program focuses on digital experiences in healthcare, meeting HIPAA compliance. To address this topic today, we're fortunate to have as our guest speaker, Twain Taylor, an independent technology analyst. Twain began his career at Google, where among other things, he was involved in tech support for the AdWords team. His work involved resolving issues affecting both customers and the support team and handling escalations. Later, he built branded social media applications and automation scripts to help startups better manage their marketing operations. Today, as a technology analyst, he talks about modern software delivery and the culture and tool chain that enables it. We're fortunate to have Twain with us. Twain, the floor is now yours.
Thanks, Mike. We start off by looking at the various kinds of organizations in healthcare. The healthcare industry consists of clinical trial and pharmaceutical organizations, health insurance organizations, hospitals, and even startups that manufacture personal fitness monitoring devices. Across these organizations, there's various types of data. For example, data about drug testing and clinical trials, financial data about transactions, patient health records, and machine-generated data. So there is a lot of variety in the data across these organizations. And for legal reasons, some hospitals and healthcare entities keep legacy systems so that they can be compliant with regulations and have full control over their data. But healthcare is still going through a lot of change. And let's talk more about that on the next slide. Today, we're seeing a big shift in healthcare services. It's being driven by a focus on patient-centered services. No longer are healthcare organizations willing to let back-end systems that are outdated to define and dictate how the patient experience should be. The way they're doing this is by digitizing all of their applications and systems end-to-end. This way, systems and technologies become an enabler to patient-centered services rather than placing obstacles at every step. When the back-end applications and data of a healthcare organization really serve to deliver an outstanding patient experience, it helps to earn the trust of patients and to really build confidence in the healthcare organization at every step. There are 2 reasons why healthcare organizations should really drive digitization. The first is that there's little margin for error. The way a healthcare organization handles its data has real consequences for patients. Second, compliance is a top priority for any healthcare organization. With strict legislation like HIPAA compliance, the priority today is on how healthcare organizations handle their data. When we're looking to drive end-to-end digitization in a healthcare organization, there are primarily 3 challenges that come up. First, you may be dealing with an outdated technology stack. This includes outdated applications and infrastructure, or relying on on-premise hardware for data storage, or using outdated tools that are not cloud-ready. Also, there are applications that are not mobile-friendly. And as we know today, mobile plays a big role in delivering patient-centered services. So the technology stack is the first challenge. Second, there are many key decision makers in a healthcare organization. This includes IT executives like a CTO or a head of IT, third-party vendors like payers and suppliers, and even healthcare professionals like physicians, nurses, and radiologists. For digitization to be truly successful, all these key players need to be on board when adopting a digital solution. Finally, handling sensitive data like electronic health records and protected health information is really important. This can't be an afterthought. You need to plan ahead right from the start, thinking about how to handle data so that it's compliant and secure. The cloud is really important when driving digitization in healthcare. One stat says that 35% of healthcare organizations house 50% of their data or more in the cloud. Now, this is better than the cloud adoption rate for energy and utilities organizations and financial services organizations, which stand at 31% and 18% respectively. The reason healthcare organizations are moving to the cloud is to enable better security against data breaches and to more efficiently enable communication between doctors, patients, and everyone involved. When moving to the cloud, a healthcare organization can't just go with any cloud platform. You need to pick a cloud platform that's built for healthcare. The cloud vendor should really get healthcare. You need a cloud platform that has healthcare-specific services. This includes applications that are commonly used by healthcare. It means having HIPAA compliance built in end-to-end across all the services that the cloud platform offers. It should be easy to drive adoption internally by key decision makers. It shouldn't be that just IT is excited about the new cloud platform and they roll it out, but then doctors don't want to use it. Patients can't find their way around applications. That's a total failure. Instead, we're talking about 100% adoption rate by everyone involved. This is what it takes to deliver a modern healthcare experience. It takes a cloud that's purpose-built for healthcare. On the next slide, we dig a little deeper into what a healthcare cloud would look like. It would involve reusable cloud-based components. This includes pre-built application templates that you can simply take off the shelf, customize, and quickly stand up a front-end application that's mobile-friendly. We're also talking about data integration accelerators that already connect existing healthcare applications. This way, you can simply connect your data stores in a matter of minutes and start using them right away. When you have this level of ease, it really quickens the amount of time you spend integrating data and getting it ready for access by front-end applications. And even creating new features in front-end applications becomes a breeze. And this is really what helps deliver integrated patient services end-to-end. On the next slide, we talk about monitoring and security for healthcare. A health cloud needs to give you complete control over all of the data you store in the cloud platform. This means having mature identity and access management features, including role-based access controls. It should allow you to give different privileges to different users according to their role. We should also be able to monitor how each of the users access data. Second, data encryption is really important, not just when data is in transit, but even when it's stored in a cloud storage solution, or when it's on an end-user device like an IoT device. As you bake in HIPAA compliance into your development process, you can build trust and gain access to even more patient data, which can further enhance your applications. To summarize what we've covered so far, what would a cloud service for healthcare look like? First, it would have accelerators and templates to speed up data integration and data development. Second, it would be HIPAA compliant. Finally, a cloud service for healthcare would enable you to drive 100% adoption both internally and externally. On the next slide, we look at some specific options for a health cloud. First up, the leading infrastructure as a service cloud vendor, AWS. AWS has a range of HIPAA compliant services, and it has some great options for compute and storage. But beware, because not every single service of AWS is HIPAA compliant. So that's something you need to check on a case-by-case basis. Now, within AWS, it's easy to integrate one service to another. But if you're looking to integrate it with an external platform like SAP or Salesforce, you won't really find a pre-built integration already there. You'll need to custom build it. Another thing with AWS is that you'll have a lot of control over the kind of compute power, the storage options that you can have. But that comes with the cost of having to manage it all on your own. And this can be difficult. So to summarize, AWS is an option with a lot of powerful capability, a lot of potential, but it may not be the easiest to set up and maintain in the long run. We look at option 2, Progress Kinway. Now, this is a cloud platform that's HIPAA compliant end-to-end. Progress Kinway enables speed because it has pre-built application templates and data integration accelerators, which let you integrate any enterprise data system, whether it's SAP, Oracle, Salesforce. It also lets you quickly build front-end applications by customizing pre-existing templates. Progress Kinway has templates for things like patient health records, patient engagement apps ready-made, and you can easily just customize these templates and start using them immediately. Kinway integrates with all of the leading healthcare applications. Progress Kinway has wide device support. As new devices come into the market, you can be sure that Progress Kinway will support those new devices. And this is critical in a world where IoT and new healthcare devices come into prominence. Progress Kinway is a serverless platform. This means you don't need to configure or manage any servers. You can just define the resources you need. And Progress Kinway does the rest for you. It provisions all of the resources you need. So you can focus on building your applications, adding new features, and focusing on the business logic rather than doing all of the plumbing for infrastructure. With Progress Kinway, you can simply log in and get started building applications really quick. That's why it's a great option for a health cloud that drives high productivity. Finally, to conclude on the next slide, healthcare organizations are looking to drive patient-centered digital experiences. But at the same time, they can't compromise on HIPAA compliance. And this requires a cloud platform, but not just any cloud platform, a healthcare-specific cloud platform. A health cloud would accelerate application development by having pre-built templates and data integration accelerators. Importantly, it would be HIPAA compliant end-to-end. For the platform to actually be successful, it needs to be adopted internally and externally, 100%. And when this happens, healthcare organizations can get the best of both worlds. Digital patient experiences and HIPAA compliance. With that, we come to the end of this webinar. Thank you.
Thanks, Twain. Ladies and gentlemen, that does conclude our program for today. Thank you again for joining us for this program, which was sponsored by Progress Software. As we mentioned, this is the third in a series of 3 webinars on the topic of cloud-based application platforms. Make sure to check out the other 2 programs when you have the opportunity. Thank you again for joining us, everyone. Have a great day.